I am so glad that you guys are all here for us this morning. I am Chris Brown. I am a volunteer. I am a caregiver. And I'm an advocate. On behalf of the American Cancer Society, our advocacy affiliate, the American Cancer Society Cancer Action Network, and the DCH Cancer Center, I want to welcome you here this morning. The American Cancer Society saves lives by helping people stay well, get well, find cures, and fight back. ACS CAN supports laws and policies at all levels of government that help people fight cancer. We can be found at our website, acscan.org. Once again, I want to thank DCH Cancer Center for hosting our event this morning. As you'll hear, the Cancer Center does an amazing work in screening and treating women for breast and cervical cancers. They are a vital link to low-income and uninsured women in our community. We are here today to celebrate the Breast Cancer Awareness Month, and we want to emphasize the critical importance of cancer prevention and early detection, which are key to saving lives when it comes to breast cancer. We're also here to mark a major milestone in the fight against breast cancer. A federal program, the National Breast and Cervical Cancer Early Detection Program, is providing women with screenings that could save their lives. Low-income, uninsured, and underinsured women have access to life-saving breast and cervical cancer screenings because of this program. This fall, the National Breast and Cervical Cancer Early Detection Program will perform its 10 millionth screening, according to the Centers for Disease Control, which administers the Breast and Cervical Cancer Program. One of the women screened by the Alabama Breast and Cervical Cancer Early Detection Program is with us today, and it is my pleasure to welcome Judy Curtis to speak with you guys about the program.
I am going to be a one-year survivor on November 24th, and I just want to tell a little bit about my story. I don't have a job here yet. My main priority when I moved back to Alabama was to take care of my mother who's ill. So not having any income, and we live on a very, very low budget. So my thought is that a doctor is out of the question. There's no way I could ever afford to go to a doctor or get help. But my mom told me about the screening process at DCH for getting a mammogram. And since I have never had a mammogram, I went ahead and went. And I was 45, and that's the first breast mammogram I'd ever had, and they found cancer. So I am so grateful for this program. Without this program, there's no place for people like me to go and get help. It saves lives. I can attest to that because I'm here, and the people here are wonderful, and the Breast Cancer Society and ACS is saving women like me, and you know, who there, like I said, there's nowhere else for us to go. We don't have a doctor. We don't have a way of paying for any kind of mammogram or tests or treatments. And I think that this is the most important thing to research and to funding, because there are so many women who will not even consider that they have a chance to see doctors or get help. And I think that's a sad statement for our society, but these people here are great, and I can't thank them enough for saving my life. Thank you.
From a doctor's perspective, I guess I wanted to give you, my take on why this becomes so important, and especially in these two settings. I mean, breast and cervical cancer, from a cancer physician's perspective, is an area where we have seen tremendous gains over the last several decades. Breast cancer was the first area, besides the early improvements in survival that we had with leukemia and lymphomas, where we started seeing the cancer death rate go down. It's the first area that the CDC reported that going down. We've seen cervical cancer follow the same way. So this, breast cancer and cervical cancer are two of the cancers that we consider to be, extremely curable cancers if they're caught early. And there are also two cancers that from, as lawmakers talk about the big picture and the cost of screening and what it benefits, the treatment for early stage breast cancer and cervical cancer are fairly simple treatments, fairly easy treatments. From a cost perspective for the medical care, they're much smaller than for more advanced stages. As far as the productivity of the person and how quickly they get back to their normal life and what they were doing, it's a huge difference between early and advanced stage for both breast and cervical cancer. So when we see something like this that lets people come in that are scared to come in, that 20 years ago would have come in with a stage 3 or a stage 4 breast cancer or a stage 3 or 4 cervical cancer, and now we can offer them a way to get screened and pick it up as a stage 1, or in breast cancer, a lot of those we pick up as a stage 0. I mean, that's an easy thing to treat. The person is back to normal life. They're back being a productive member of society very quickly when we pick it up at these levels. This is what we work, this is what we want. This is what we work hard for. These are the people that we want to help, because it's huge. It is a huge difference in how we get these people back to normal life when we catch it early. So the numbers that we put out here are great, and I know that's the bean counters. I know that's what they look at, but it's more than just what you can see with the number of cases that are diagnosed and when it happens. It's for us, it's all about picking it up early, where we can change where this person's life is going. This program does it. I mean, these are two areas where the screening is good. It picks up things early, and we can treat it once we know where it is. You have to have all of those things in place for it to be a successful prevention program, an early detection program, and all those things are there with these two cancers. And it's just critical that we keep this going and really improve it. I mean, the saddest thing is when you look at how many people, how many women take advantage of the program. To be honest, it's we're still only hitting about 20% of the people that need to be coming into this program. So if anything, we need to be thinking bigger with this rather than smaller.
Now, on behalf of cancer patients, survivors, their neighbors, families, and friends, I am asking Senator Shelby to make the fight against breast cancer a national priority during the ongoing deficit reduction talks. Funding for cancer research and prevention programs must be a funding priority for the nation moving forward. We need to ensure that progress continues in our fight against cancer. The simple truth is, this program should be expanded, not cut. The lives of women in our state and across the country are depending on Congress to make the right decision. I want to thank you guys for coming out today, and I hope you take what we've said to heart. Make sure that we make cancer of all kind a national priority, and we're able to say, what was that thing called cancer? Thank you.